Have you ever wondered if something that feels intimate could also be unsafe? Not because of rumors or myths, but because no one ever really explains the facts. I'm Dr. Sophie Morgan, a board-certified urologist with over 10 years of experience helping men restore vitality, circulation, and confidence naturally. And today, we're going to talk about one of the most whispered questions in men's health, one that many of my patients have wanted to ask but never dared to say out loud. They'll lean forward in my office, lower their voices, and finally whisper, "Doctor, is it actually safe to swallow vaginal fluids during oral intimacy?" It's the kind of question that sounds simple, but carries layers of worry, curiosity, and even guilt. Some men assume it's unhealthy. Others wonder if it's strange to even think about it. And yet these private concerns quietly shape confidence, trust, and connection in a relationship. Here's the truth. Intimacy should never feel confusing or shameful. When you understand the science of the human body, what once felt awkward becomes something you can talk about openly with calm, respect, and confidence. Before we dive in, I want to know, where are you watching from today? Type your city or country in the comments. I love seeing this community of men from the United States, Brazil, Malaysia, Rwanda, and Canada coming together to reclaim their vitality. Now, let me ask you something deeply personal. Have you ever held back during intimacy because of worry about safety, smell, or taste? Type yes or no in the comments. Because here's what nobody tells you. And it's the one discovery that changed how I practice medicine. After 10 years of sitting across from thousands of men, I noticed something disturbing. The men suffering the most weren't the ones with medical problems. They were the ones carrying fear based on myths they'd never questioned. And there's one myth in particular, myth number 4, that's so deeply believed, even some doctors get it wrong. I'll reveal exactly what it is at the 6-minute mark, but I can't give you the answer until you understand myths 1, 2, and 3 first. Because without that foundation, the truth won't make sense. And here's what might shock you. The answer to your original question, is it safe? Isn't actually yes or no. It's something far more nuanced. Something that depends on one factor most men completely overlook, but we'll get there. First, the biology. Vaginal fluids are not dirty. They're one of nature's most sophisticated protective systems, designed by evolution to guard delicate tissue, prevent infection, and create comfort during intimacy. According to research from the Cleveland Clinic and the Mayo Clinic, healthy vaginal lubrication is mostly water, combined with amino acids, protective enzymes, and beneficial compounds. Here's the simplest way to understand it. Your mouth produces saliva to keep itself clean, balanced, and protected from bacteria. Her body does the exact same thing for the reproductive system. It balances pH, controls harmful bacteria, and releases lactobacillus, the same probiotic found in yogurt. What you feared as mysterious or risky is actually a biological masterpiece. But here's where everything breaks down. And this is the pattern I see every single week in my practice. Men encounter a normal variation, something completely natural, and because they don't understand the science, they interpret it as danger. They panic, they pull away. And that single moment of fear creates a cascade that destroys intimacy for months, sometimes years. Let me give you myth number 1 right now, because it's the most common. Myth number 1, any change in taste or smell means something is medically wrong. False. Listen to me carefully. Just as your sweat smells different after garlic, just as your breath changes after wine, just as your skin feels different after exercise, vaginal fluids respond to the exact same factors. Diet, hydration, hormones, stress, medications, even the time of month. If your partner had coffee, spices, or alcohol, the scent shifts. If she's dehydrated, it's more concentrated. If she's just finished working out, her pH is temporarily different. The Cleveland Clinic confirms that these microvariations are signs of a healthy, responsive system. Only a strong, persistent foul odor combined with visible irritation signals imbalance, and even that is usually a minor bacterial issue, fixed in days with simple treatment. But here's what men actually do. They encounter a slight change, and instead of asking, instead of learning, they retreat. They avoid intimacy. They create distance. And the woman, sensing rejection, assumes it's about her body being wrong. That silent assumption kills more relationships than actual medical problems ever will. Quick question. If you've ever felt this worry, type the number 1 in the comments. If you think men worry too much about this, type 0. I need to know where this community stands. Now here's myth number 2, and pay close attention because this one sets up the big reveal later. Myth number 2. If it's natural and healthy, it must be 100% safe no matter the circumstances. And this is where men get dangerously overconfident. Yes, in a healthy, infection-free partner, vaginal fluids are protective, but they can still transmit infections if either partner carries one. Chlamydia, gonorrhea, herpes, HIV, these can spread through oral contact, though the risk is much lower than penetrative intimacy. Here's the part that most men miss. The danger isn't the biology, it's the assumption. It's thinking, we've been together for years, so we must be fine. It's believing, she looks healthy, so there's no risk. It's avoiding the conversation because it feels uncomfortable. And that brings me to myth number 3, the one that traps men even when they know the science. Are you still with me? Because this is where it gets critical. Myth number 3. Once you're in a committed relationship, testing and health conversations are no longer necessary. Gentlemen, this belief is quietly eroding trust in thousands of relationships. Here's the truth. Health isn't static. Bodies change. Bacterial balances shift. Medications create new variables. Even long-term monogamous couples benefit from occasional testing, not because of suspicion, but because bodies are dynamic systems. And when you approach it that way, when you say, let's do a wellness check together, just to make sure we're both feeling our best, it's not threatening, it's caring. But here's what stops most men from ever having that conversation. And this is myth number 4, the one I promised you at the beginning. Remember when I asked if you'd ever held back during intimacy because of worry? This is why that question matters. Myth number 4, the deepest and most destructive myth of all is this. Asking questions about safety, taste, smell, or comfort means you're not a confident man. That real men just know what to do. That uncertainty is weakness. That belief is a prison. Let me tell you about Vincent. He was 64, married for 36 years to his high school sweetheart. He came to my office barely able to make eye contact. He said, "Doctor, I've been avoiding intimacy with my wife for almost 4 years. Not because I don't love her, but because I started noticing changes, different taste, different scent, and I was too ashamed to ask if it was normal." 4 years. This man suffered in silence for 4 years because he thought asking made him less of a man. I explained everything we've talked about today, the biology, the myths, and then I said something that made him cry. Vincent, the most confident thing you can do is admit you don't know something and ask. He went home that night and had the conversation he'd been avoiding. His wife looked at him with tears in her eyes and said, "I thought you didn't want me anymore. I thought I was broken." They weren't broken. They were silent. Within 2 months, Vincent sent me a message. "Dr. Morgan, we're closer now than we've been in 20 years. All because I finally asked." Now, do you see why I couldn't give you myth 4 until you understood the first 3? Because without context, you'd miss the weight of it. The answer to is it safe isn't just biology. It's communication. It's courage. It's the willingness to say, I don't know, but I want to learn with you. If you think asking questions is strength, type 3 in the comments. If you think men should just figure it out on their own, type 4. Show me where you stand. So how do you actually do this? How do you have these conversations without awkwardness? Here's the framework that works. First, timing. Never during intimacy. Choose a calm moment. Over breakfast, during a walk, in bed before things escalate. Second language, lead with partnership, not interrogation. Not have you been tested, but I'd love for us to do a health check together so we both feel completely confident. Third, turn hygiene into connection. Showering together before intimacy isn't a checklist. It's a ritual. It's slowing down. It's showing your partner that presence matters more than performance. And here's the science most men ignore. Hydration changes everything. When your partner drinks enough water throughout the day, her natural lubrication becomes lighter, smoother, more comfortable. The same is true for you. Circulation improves. Sensitivity increases. Fruits like pineapple, strawberries, and citrus can enhance taste naturally because of antioxidant content and lower sulfur compounds. So yes, sharing a smoothie isn't just romantic. It's biochemical preparation. But here's what pulls it all together. Let me tell you about Gregory, 57, divorced after 25 years, re-entering dating, terrified. He met someone he truly connected with, but the first time they became intimate, he noticed something unfamiliar, a stronger taste than he expected. His instinct was to pull back, make an excuse, avoid it, but he remembered our conversation. So instead, the next morning over coffee, he said, "I want to make sure we're both comfortable. Can we talk about what makes intimacy feel safest for you?" His partner paused, then smiled and said, "I've been on a new medication. My doctor said it might change things temporarily. I was worried you'd be disgusted." Instead of destroying the relationship, that conversation deepened it. Because here's what I've learned after 10 years of practice. Intimacy isn't about having all the answers. It's about being willing to ask the questions. Think of it like this. Breathing is natural. You don't think about every inhale, every exhale. It's rhythmic, essential, effortless. But when fear enters, you hold your breath, you tense, you lose the rhythm. Fear makes men hold their breath emotionally. But when you replace fear with curiosity, with communication, with courage, you exhale fully, freely, deeply. So here's my final challenge. Tonight, ask one question you've been avoiding. Not just about intimacy, about anything. What do you need from me? How can I make you feel safer? What have I missed? Watch what happens when honesty replaces assumption. What did you learn today? The biology, the myths, the communication? Tell me in the comments. I read every single one. Like this video if it helped you, because every click helps another man find medically accurate, shame-free guidance. Subscribe if you haven't, because we talk about real issues here. Health, confidence, vitality, and connection that last decades. And remember, you are not too old to learn. You are not too old to ask. You are not too old to connect deeply with another human being. Age doesn't weaken intimacy. It refines it. Because you've earned the wisdom to know that vulnerability is strength and questions are the foundation of trust. I'm Dr. Sophie Morgan, reminding you that your health is your confidence is your connection, and passion has no expiration date. Take care of yourself, take care of your partner, and I'll see you in the next video. This video is for educational purposes only and does not replace professional medical advice. If you are experiencing pain, changes, or concerns, please consult with your healthcare provider. Your health deserves professional guidance.